In early 2013, I had private health care, but as stated earlier, all health care is greatly controlled by Obamacare. I established a doctor-patient relationship with Dr. Sonali Kulkarni, practicing at a Innova-owned neurology doctor's office in the Virginia suburbs of Washington, D.C. Dr. Kulkarni's medical records on January 26, 2013 said as follows. 42-year-old male patient was mainly healthy. He did not even see a physician for 10 years. He suffered a head injury by the negligence of another physician in 1996, and his main problem was chronic migraines. Then in 2003, while being treated with migraine meds, perhaps overuse, he got chronic numbness and drowsiness and some dizziness in the head. So although an unexpected outcome, the new condition knocked out the migraines permanently, so the patient isn't really complaining, but with the new condition, he has difficulty driving continuously for more than 30 minutes, and at work, he can only work for about 6 hours per day with a nap in the middle, and all that he is really here for is to get medical records that can support his need for workplace accommodations. One of the tests that Dr. Kulkarni ordered was a MRI of the head. All that was supposed to occur is that I was supposed to wear some gym clothes and in the middle of my day go and lie down for 45 minutes and then immediately resume my daily routine. All in all, I am barely a patient. I was only having a glancing encounter with the medical community. I subscribe to a conservative treatment style, and I did not even want to have any test. I already knew that my symptoms were stable for 10 years, and that MRI of the brain in such a case is simply for the medical community to make money. Dr. Kulkarni, after I had seen her, in exchange for professional favors given by Dr. John Cochran, the head of the neurology practice, and paid out of the coffers, but it wasn't money, it was professional favors, and paid out of the coffers of Innova and Virginia Commonwealth Medical School, which had a joint operation in Northern Virginia. Dr. Kulkarni agreed to the indecent proposal, but unlike the movie, Dr. Kulkarni had not agreed to become a prostitute. If there can be any play on a movie title, it should be Deliverance on the Potomac. Dr. Kulkarni comes from a wealthy family and her husband is a high-earning physician, but at age 45 and spending large sums of money for more and more education and training, first training to be an ophthalmologist, no other neurologist added Dr. Kulkarni to their practice for 10 years after completion of her neurology residency. Dr. Cochran brought her on in some minor capacity. The indecent proposal allowed Dr. Kulkarni to catch up, and this included making this loser at her field the director of a mentorship program aimed at convincing the top med school students to enter into a neurology residency. Dr. Kulkarni accepted the indecent proposal prior to my appointment at Capital Imaging in Bethesda, Maryland, a suburb of Washington, D.C. that sits, and this facility actually sits, the small office sits next to the National Institute of Health campus. The agreement was as follows. Dr. Jeff Jacobson, a neurosurgeon, the primary owner of Capital Imaging, which only has a single MRI machine and nothing else. And the primary function of this MRI machine is for Dr. Jacobson, who practices in Washington, D.C. 4 days a week, to send those D.C. patients to his MRI machine in Maryland. Then another co-owner of the facility, Dr. John Athos, a radiologist physically in New York, can write a false interpretation such that insurance agrees to back surgery. Such that insurance agrees to perform back surgery. These surgeries would be done at Johns Hopkins Suburban Hospital in Bethesda. Court documents and statements from Dr. Jacobson's patients all show the same thing. Dr. Jacobson was running a surgery mill at the Johns Hopkins Hospital. Dr. Jacobson had the skill to perform these unnecessary surgeries without injuring his patients. But the depth of his greed is so great that he uses all the shortcuts at the same time. For one patient, Dr. Jacobson used something like a large power drill to get the job done fast. The drill severed some nerves and sucked them into the drill. Dr. Jacobson just shook the nerves out of the drill and glued the nerves back on. And then the patient during recovery early discovered on his own that he permanently lost bowel and bladder function. So what Dr. Jacobson did for me is he wasn't really supposed to take any part in my medical care because because everything was supposed to be done by the MRI tech who has the state radiographer's license, and no one else is really supposed to be involved in the process. But this Dr. Jacobson of Johns Hopkins, he specially trained with short notice, just after I made the appointment. He specially trained his MRI tech, Mr. Manuel Makayong Papel, and the Maryland Board of Physicians even allows him to use the alias of Antonio for a first name. And so this person is also well immersed in all the frauds. But he trained him to insert a needle through the back of the left hand, navigating through bones and nerves without striking the nerves, because the pain would be so great that no patient would allow it to proceed. And then enter into the ulnar artery deep inside the hand, and then have the needle point upstream. So Dr. Jacobson owns the entire 3-story small office building with capital imaging in the basement and his neurology office on the 3rd floor, and the other space is unoccupied. His neurology office is only operational on Fridays. The other days he's at his DC offices. Physicians all have medical assistants, and if at all there is any formal training, it is some certificate course. So a woman in her 30s in the Washington job market of today working as a medical assistant would be said to be something of a dummy. Dr. Jacobson has one such woman who is his lead assistant, who is on the attractive side, and I don't know her name. This dummy is also fully immersed in all of Dr. Jacobson's schemes. Some of the patients that Dr. Jacobson injured mentioned calling his office and getting the runaround and not getting anywhere. So this dummy does not have any skills in the legitimate job market, but Dr. Jacobson trained her to do some bad things. This dummy may be also something of a confidant. This dummy would be sent from the neurology office upstairs to the MRI office in the basement to wait for me. And just like some produce buyer or such, this dummy would check me out and then rush back to Dr. Jacobson's office to report if I am what Dr. Jacobson is looking for. There is another woman, Michelle Miller, also in her 30s, and she's probably even more of a dummy. She's a receptionist for capital imaging, and the work only consists of a few phone calls per day. She's also a part of all the schemes, but someone who is not around Dr. Jacobson as the other one. So although she could have checked me out and phoned Dr. Jacobson would rely on his confidant. Mr. Papel, the tech, would use the pretext of the contrast injection having failed when it had not, to insert the catheter on the back of the hand, add an extension line, and put me in the MRI tube. Dr. Jacobson would enter the room and inject a large quantity of water and force the water and blood in reverse to reach the brain and flush much of the blood out of the brain. This would render me unconscious. Dr. Jacobson, Dr. Cochran, the two women, possibly another person from the office, Patrick Jackson, who has felony convictions for defrauding physicians and veterinarians, and others would commit sexual assault. A quick note about Mr. Jackson, Dr. Jacobson's associate, who has absolutely no medical training. He's just an outsider scamming doctors and such. So Mr. Jackson defrauded Patrick Jackson defrauded physicians and veterinarians out of hundreds of thousands of dollars. Even stole $10,000 from a veterinarian in the poor country of Honduras. And yet police and prosecutors in Maryland refused to act. Prosecutors in Wisconsin and Illinois were ready to act and put this crook in prison for a long time. Then all of a sudden, the prosecutor in Maryland wants to prosecute and then gives this crook a slap on the wrist. This looks like some funny business there. Right, just to get this guy out of jail. And then he gets no jail and no fines, and he only has to make restitution for a small fraction of the thefts. Then, to show you how small a world this is, Mr. Jackson's lawyer got another job to defend a firm that was performing psych exams on police officers in Maryland. A psychologist became a whistleblower. She reported to the Maryland Attorney General's office that the owner of the psych firm, in an email solicitation, openly stated that cheating and shortcuts are allowed, such that all police officers are quickly declared to be psychologically fit, and she can make a quick buck by doing, many exams at the same time. So the Maryland Attorney General's office was the proper, she had gone to the right agency. The Maryland Attorney General's office was the proper agency to investigate, because there was public corruption and public funds involved, and they were cheating the citizens of Maryland. But the Maryland Attorney General lied and said that the State Board of Psychologists was the agency that had jurisdiction. And just months later, it was found that, and so that was, it didn't really go anywhere. And just months later, it was found that the same firm has done the psych evaluations on the Baltimore police officers charged in the death of Freddie Gray, which led to destructive riots. It was also found that the police officer who, while she was admitted to a mental hospital, the psych firm gave a report that she was fit for police work. She came back on the job and within days used a gun issued by the police department to commit suicide. And for my matter, had Patrick Jackson received jail time, then his associates, primarily Dr. Jacobson of Johns Hopkins, would not have been so brazen to commit the violent and sex crimes that they committed. And, after the sex assault was committed over my cold and nearly dead hands, and, had I been conscious, there would have been no deliverance on the Potomac. The paddle, the rifle, the banjo, and the bat teeth would have been sitting up the derrieres of these people. Homie, don't paddle faster.